So there's been a trend to test or evaluate whether animal-derived vesicles, like cow serum, basically derived exosomes, could be useful. I would be worried personally as a clinical allergist. So I'm an allergist, as I mentioned in the beginning, and giving non-human material to the skin could definitely induce allergic sensitization, which is absolutely not anything we want. So for stability and for functionality, what are the methods? After the vesicles have been harvested from the big cell cultures and so on, I'll start with you, Kevin. What are the best way you think to transport those to the patients and to apply them to the patients?
Yeah. So depending on the purity of the product, whether it's really purified proteins or EVs, or whether it's more of a secretome-based therapeutic, there's going to be potentially some bioactive molecules that could degrade the product. So classically, people have frozen the product in ultra cold temperatures until use in the clinic. That presents a cold supply chain issue, of course, and so a number of companies have moved toward lyophilization and stabilization of the EVs in a dehydrated state, which I actually think holds a lot of promise. And I know of a number of companies that are trying to develop these successful lyophilization methods for storing the EVs at room temperature.
So just quickly to explain what lyophilization is, it's basically drying the material so it becomes powder, more or less.
Yeah.
And then before you apply it to the patients, you add liquid. I think a lot of stability data and maintained mechanistic function would need to be tested and evaluated for that to really work. Dr. Lim?
I agree with Kelvin about this lyophilization being the best way forward, and my group has been working on that for several years. We had a patent application in the process. So we routinely lyophilize our exosomes, and we have shown that they are very stable. So we observe that they are stable at 30 degrees, 40 degrees for up to 3 months easily. So, and it's easy, like you say, in terms of transport and storage.
I can say that when we take bacterial vesicles and lyophilize them, dry them, we can keep them in room temperature for quite a long period of time, several weeks or months, and they maintain functionality. In my lab, we haven't done that yet with mesenchymal stem cell vesicles. Have you done that?
So for clinical trial, our exosomes was in a ointment formulation, and it can be kept at room temperature. So we have done stability, I think the last was 12 months. At 12 months, 30 degrees, it was still stable.
Quite stable, that's impressive.